Hi everyone, it's Natalie again from Walden. I am here today with Joanna Imse, who's the Assistant Director at our Amherst clinic. We are going to learn a little bit more about some of the faces behind the treatment at Walden, so we're going to start with Joanna today. So we have a lot of really talented people here at Walden, and so we wanted to showcase that. So I'm going to start off with some questions, and please feel free to like or comment or ask questions for Joanna as we go through this. And also after, if you want to leave any questions in the comments, we can try and go through this with Joanna.
Excellent, thank you so much.
Okay, so talk to us a little bit about your role at Walden.
So currently my role at Walden is I'm the Assistant Program Director at the Amherst Clinic, and it's a great location. So we're on University Drive, we're really close to the 5 colleges, it's great geographically for that area, bus stop right there. So physically the clinic is in a great spot, and it's beautiful, it's relatively new. So I'm the Assistant Program Director there, and that can be all kinds of different things. That can be case management, that can be answering phone calls, that can be talking to parents, talking to insurance companies, supervising, creating curriculum. It's really all kinds of different things on a daily basis, with the overall goal to give our patients the best treatment possible and to provide really good clinical support and experience for our staff.
Cool. Yeah. What kind of brought you to Walden or eating disorders in general?
So I love that question, and I talk about that a lot when I interview or even when I do trainings with people, because it wasn't necessarily a planned journey to get here. My background, I got my MSW at Salem State, and my background was a lot of behavioral interventions and family-based treatment. So going into the home, doing a lot of behavior modification with adolescents, but that's hard. It's hard in a different way. There's a lot of burnout. And I think I'd had a really tough work week. I knew I was looking for something different, and I didn't have an eating disorder background. I had applied for a couple of jobs online and heard from Walden and took it from there. I actually interviewed as an admissions person with Paula Bass, and she was great and said, I think you could work at admissions, you can do the clinical, but I have a program in mind that I think you'd be a good fit for, which was our adolescent IOP. Very family-based, very behaviorally based program, and so I went there. I had actually verbally accepted a job somewhere else. I went there, I shadowed program, fell in love with it, loved the staff, loved the intervention, had a wonderful experience, and was on the phone with HR within a few days with the job offer and the plan to start. So my journey there wasn't necessarily about eating disorders. I learned it fast. I had to, given the circumstances of where the company was at the time. Right. But I did have the family background, the behavior modification piece, and so learning the eating disorders was a challenge, but so incredibly rewarding, and probably one of the best professional decisions I've ever made. So.
And one of the best hiring decisions as well.
I could go Paula. Yep.
But I'm not biased.
Yeah.
Okay, so describe the Amherst clinics. What kind of programs do you offer? Do you have any different tracks that maybe some of the other clinics might not have?
So the Amherst Clinic, it's one of our ambulatory sites, so we have a couple of different programs. So we have Adult Partial program, which runs Monday through Friday, 8:30 to 2:30. Adult IOP, and that can be during the day or at night, and that traditionally is 3 days a week for 3 hours, but we have some flexibility. Let's say we have a client that can really only do 3 hours a day, but we can work with their insurance and maybe they come 4 or 5 days a week to start, with the goal to only come 3 days a week. So again, these are the programs, but we do our best to be really flexible and meet the client where they're at. With our adolescent program, we have our adolescent IOP, which is 3 evenings a week for 3 hours. Really a strong parent component involved there, where parents come for coached meals and for groups. We also have adolescent partial, which is again 6 hours a day, 5 days a week. Some of the different programs that we also offer are binge eating track, and so that is where the clients come in and they focus on binge eating diagnosis or behaviors. They meet with a dietitian, they work with their therapist, and that tends to be a little bit of a shorter intervention based on a 4-week model, but again, it's really where the client is. Additionally, we offer Survivor Track, and that's for clients that identify as trauma survivors, and that's really self-selection, so we don't necessarily say that is trauma, that isn't. It's a lot around, do they need to work on containment, grounding, skills like that, usually in conjunction with outpatient treatment. The other really unique track that Amherst has is an LGBTQ track, and this is designed for clients that either identify questioning, looking for more support, and this track really allows clients to to receive psychoeducation, to talk about eating disorder in that lens. So how does that affect safety in your body? How does that affect safety in relationship with food? So really a specialized place for clients that either identify, questioning, need more support, where they can go on a weekly basis. And that's unique to Amherst right now. Additionally, we're going to be also looking to start a substance use track, hopefully late spring, early summer, to give our clients even more support.
Great. And those programs are separated out from the rest of the milieu, or how does that work?
So they're called tracks. So all of our clients that come will have a group offered at that time. For example, let's say Monday, I believe it's 1 to 1:45. So if you're in program during that time, you can go to the family relationships group, or if you self-select as somebody that would like more information about the LGBTQ track and or identify that way, you would then go into the LGBTQ track in a separate room. So it's done pretty streamlined. The announcements are made so that clients feel comfortable kind of coming and going, and they're able to get that support. We also offer an alumni support group every week that's open to Walden alumni and others who need support in the community.
Is that a free group?
That is a free group, yes.
Okay.
Yep.
Cool.
Mm-hmm.
What's the average day like for our patients?
For our patients, again, it's about sort of having a model of care, but also really individualized treatment. So in Amherst, our clients come in, let's say they're coming in for a partial, they may start with weights and vitals, they'll do a coached meal with breakfast, and that might be 1 or 2 staff depending on the census. Their day may start with a DBT skills group, they may have yoga that we offer twice a week, we have pet therapy in Amherst where a therapy dog comes out once a week, so it really depends on the day. Our clients, we really try to do a mixture of different types of groups, so process groups, skills-based groups, groups that are based on a handout, more process groups. And one of the core things that I think we do in Amherst that we do in many of our clinics is really try to listen to the feedback of our clients. So for example, in weekly community meeting, our clients may say, you know, we're really feeling like we need more body image, or we really feel like recently we're all struggling with upcoming spring break or grades. And so for us to really as a staff to think about the schedule, to think about the upcoming groups and respond to the needs of the milieu based within obviously the framework of the agency and what we are providing for our staff and our clients.
That's great. What do you find most challenging about working at Walden?
You know, I think that totally depends on the day. I think eating disorders are a tough population. They're also really fabulous and amazing and a lot of fun and challenging. You know, it is challenging to work with clients that are sick physically and mentally. That goes hand in hand with the reward of working with clients that are sick physically and mentally. So that is a challenge. I think, you know, being an effective manager, that's a challenge to sort of find that balance between what the client needs and what the staff needs. You know, we certainly work with a lot of outpatient providers, a lot of insurance companies, so there's a lot of things to balance, and really practicing that in our own lives can be really tricky. So sort of managing all of the needs of the clients, of the staff, of the company on a daily basis. Some days I think I do it really well, and some days I really don't. So, you know, that would be an ongoing challenge.
Great. Kind of in contrast to that, do you have like a shining moment that you can remember at Walden that was like your favorite moment or like most inspiring? I mean, we have a really inspiring population of people.
We do. I think that's a really tricky one. I think some of my favorite moments are the clients that come back and are recovery speakers, and that's awesome. So sometimes it's a letter, sometimes they actually come in and speak, and that is so cool because you might remember that client kicking and screaming, literally.
Joanna works a lot with adolescents.
Or, you know, plates flying across the room, or curse words, or all of these things that you sort of sat in, day out, and then you have somebody come in and speak about going to college or dating or starting a family or seeing these things. So I think when you see the progress in the recovery speakers, those are really favorite memories from mine. I think anytime we do really emotional goodbyes is a favorite memory, whether it's with the adolescent or the adults, and they really are authentic in saying like thank you. Whether they're in recovery, whether this was a step in their journey in a different direction, but really hearing clients that recognize the work that the staff puts in, and hearing their peers recognize it for each other, I think that's incredibly validating because there are so many challenges that again come across in this work. So anytime we recognize the positive, that's a lot of fun.
That's amazing. I like that. I have a question, what's your favorite memory? But that's kind of like the same thing. What are 1 to 2 pieces of advice that you might give to either a patient who is a prospective patient or someone who is going through their recovery journey?
That's tricky. I think it's different for everybody. I think one thing that again, this is very subjective and only about my experience, I think a lot of times we get really overwhelmed with committing to something long term. I'm going to go to treatment. I'm going to not use behaviors. I'm going to be in recovery. And I think those are all wonderful goals and what we all want. Sometimes that's not realistic. Sometimes it really is, you don't have to commit to it all. Can you make the phone call?
Yeah.
Can you come in for an evaluation and see what the space is and say, okay, I like that there's a window here. Great, this is one positive thing you've identified. Can you commit to 1 day of treatment? I'm literally going to come in once and see. Knowing obviously the goal and recommendation is probably significantly different. And sometimes we need to start there with, I'm going to come in for a day, for a week, for this, for that, versus saying, I'm going to do recovery forever. Because ideally those really small steps and those small commitments to change are what lead us to those bigger pictures and that long-term progress.
And I hate to interrupt you here, but this is like a perfect situation for me to say this is, at the Amherst clinic, in addition to all of our other clinics, we always tell patients who are kind of, which are most patients, wary to come in, is like we can definitely offer a meet and greet. So if you are kind of questioning whether or not it's treatments for you, or you don't know if you want to come to Walden specifically or looking at other programs, it's a great opportunity for you to come in, meet the director. This is why we're doing this too. You can meet Joanna and kind of realize what her personality is like. Can give you a tour of the clinic, kind of meet some of the clinicians that you might be working with. So
Yep, we can definitely do that. And as always during this, if anything I'm saying or Natalie's saying generates any questions, please feel free to type them in. We'll do our best to answer in real time. I think the other piece to go with that, Natalie, is also I would always encourage people to think about where can they challenge their openness. Support is so important. So for that, some people it might be telling a roommate. It might be telling a parent, it might be telling their soccer team, it might be telling a professor. But I think when we withhold information or we keep it secret, that can really reinforce shame and isolation. And for a lot of clients, that can be a really big first step to say, I'm coming today and my roommate knows, or so-and-so. Or my plan this week is to tell one person. So really thinking about what kind of support do you have in place, and can we be part of that support, and or how can we help you explore that?
Awesome. So moving outside of Walden and maybe your work, what do you enjoy doing outside of Walden?
It's hard to think about that. I'm so work focused most of the time. I think I probably enjoy things that most people enjoy. I like to read a lot. I usually always have something going on my Kindle or my book on tape, Audible, because I drive a lot. So I always have that. I actually have 2 good ones going.
What are you reading right now?
I have, my Kindle is more like my professional one. So I have the Power of Vulnerability by Brene Brown, who I love. I know if I met her in person, I think I'd be like, love her. And then on my book on tape, which I listen to when I'm in traffic, I think I like a really freaky murder mystery right now. So keeps me entertained when I'm driving a lot. So I like doing that. I actually, my fiance and I live near a regional theater, so we like to see live shows. So we recently saw Wicked. And now Sound of Music's coming up, so that's kind of a fun hobby that we've been able to do since it's really close to where we live. So I like seeing those things.
Awesome.
Yeah.
And what's one thing that someone we don't know about you? Like a surprising thing that we might...
I think I actually tell people this fairly often, but I think I try pretty hard to be organized and sort of put together at work.
This is exactly what I couldn't believe from you.
And I try because it's actually a stretch for me to be put together and organized, because I'm not in my personal life. Like, I'm messy, I'm not that organized, I'm really not on top of things. So I think it's a contrast to how I am at work. Like, people look at my car and they don't think it's mine because it looks lived out of, which in all reality it pretty much is. But I like to tell people that, so it strikes a balance. Like, I definitely try to be on top of things at work, but not always at work and or at home. So I think people are surprised.
She's always so put together, like you can see. I'm like, My hair is like in a ponytail.
So at home it's usually pretty different, but I think people are surprised, and I like to tell them that it's sort of a balance and an equalizer too.
It makes you more approachable too for your patients.
Yes.
Sure.
Definitely.
Okay, well that concludes our interview with Joanna. Thank you so much
Thanks
for coming.
for having me. Appreciate it.
You were a great first person to interview.
Thanks.
Again, if you have any questions for Joanna, I can definitely forward those to her. Amherst Clinic, I think the information is on the little comment section. So if you need a call, make an evaluation, you can come directly to Amherst if you're in the area and you're looking to eval. It's a quick 10-minute phone call at first. If we think that you might be appropriate for care, you can then go into the clinic for a more in-depth clinical evaluation. It's like an hour.
About.
You get weights and vitals. We ask that you bring your vitals and your blood work with you. So if there's any providers who want to call in and get some information, feel free. You can ask for Joanna.
We're always available to do Q&A, to talk about cases, whether you're an individual provider or loved one, to say, what do I do? Where do I go from here? I have this question. Always available.
We're here as a resource for you folks. So feel free to call. And again, everyone, thank you for tuning in, and we'll see you soon.